Talk will be by Dr. Leema on protecting your back ergonomics in OT and OPD. Leema is Assistant Professor in Government Medical College, Alpura.
Good evening, everybody. Basically, very recently we had a wake-up call. One of our colleagues had a shoulder pain and then which developed into a numbness. And she was like, if you take the whole team of Alapura, she was younger than at least half of us. And then the whole thing unraveled and she had a problem with the neck and the spine and stuff like that. And then we immediately realized, oh my God, this is happening. And then most of the changes were permanent. Nothing is going to change. So we realized that we really need to protect our back, our spine and all that during this thing. So ergonomics is designing your space in such a way that human efficiency is brought about. So medical professionals, as you know, especially ophthalmologists, have a high risk of musculoskeletal disorders. We have disabling back pains, neck pains, numbness in extremities. And the problem is it's all in a day's work. We're just doing a routine and you're having a problem. And it is chronic in evolution. And the moment you have the signs and you consult a doctor, it is permanent. Some of it is permanent. You might reduce the pain, but the changes that has happened in your spine is permanent. So that is something like we really need to look into it. A survey, we have lots of studies now on this, and we've realized that almost 50 to 75% of ophthalmologists are having some kind of musculoskeletal disorders, and vitreoretinal surgeons, as you can guess, has the maximum out of it. Now, what are the risk factors? So the risk factors is we're doing repetitive works under stressful circumstances, and there is a fine motor control. There is a lot of things. There's computer keypads now with EMRs coming in. So prolonged maintenance of awkward body positions, all those things becomes your risk factors. So the American Academy of Ophthalmology has a task force, and I've used their guidelines to give you these videos. So in slit lamp examination, of course, it's very important to have adjustable chairs for both the patient and you so that you can work in a good thing, so that you should be very careful that your neck is not flexed or extended. It should be straight. So that is the kind of examination. Another thing that we always do is sometimes you make, because you want to cater to the patient, you make the slit lamp closer to the patient, you bend down to see. Instead, you ask the patient to come closer and you examine like that. And as you must have seen, the JR was not all the time bending towards. So they say a custom-made slit lamp with a smaller piece will give you a more access to your eyepiece, and you don't have to bend towards a patient. This bending also happens when you examine, when you kind of explains to the patient. The patient does not understand. You have a habit of bending towards them so that they understand what you're trying to say. Don't do it. Keep yourself erective in that time. That care shown to the patient might be not a care to your spine. Now, coming to indirect ophthalmoscopy, again, a standing position will give you a hyperextension of the wrist. Then your back is going to be awkward. You have lateral turning of the spine. Don't do it. Make the patient lie down. Make the patient lie down, and the examination should be done there. And you have, if you can, you sit and do the indirect ophthalmoscopy, keeping yourself erect. Learn it. It might be better for your spine and neck. Now, computers give you a lot of awkward positions. Sometimes if you're tall, your leg doesn't go under the console. So you have to make sure that the monitor should be down. You should have an armrest. Don't sit on chairs without armrest. And there should be good back support. And now coming to the operate microscope, set your seat height in such a way that your feet is on the ground. You should never have it hanging down, And the second one is, while you do the table adjustment, if you do like this, you find yourself bending over to do the patient. Instead, your first adjustment should be your seat. Your seat should be comfortable. Then you adjust your microscope. And then you make the table height to your desired thing so that you don't hunch down to do the surgery. Now, next one is your foot pedals have to be should not be away from you, because that will create a lot of problems. It should be very close to you so that your legs are not hyperextended or anything while you're using the slit. Then, here you can see you're struggling with this thing. You should not struggle. The knob should be loose enough that you can move it during the surgery. And in microscopes that can tilt the eyepiece in such a way that you can see it properly. Now, you can have 3D glasses, and you can practice doing it on the monitor, especially for the vitreoretinal surgeons, to maintain that. Other points is contact stress, like your elbow is on the table, so you can have padded places to keep it. Breaks in between, every 20 minutes, take a walk, and maybe even do prophylactic neck exercises during that. And one thing is, since we are really promoting the industry, we can say that one size doesn't fit all. We have tall ophthalmologists, we have short ones. We can have different types of instruments for us. They don't have to give you one slit lamp and then we have to adjust it. We can tell them that we need different designs depending on you. Thank you so much.
Thank you, Dr. Leema. Any suggestion from JP sir? He is a very excellent ergonomics.
No, it's practically I have a lot of ergonomic problems. So that way I am experienced. I do get neck pain and back pain when I sit and operate for long hours. So what I do is between two surgeries, between two tables, I will walk. Actually, I do walk. I get about 4 feet in my theater to walk. So I continuously walk in the break between the two surgeries. And I'll do my neck exercise, flex and all. I have kept music in the theater. And another problem other than musculoskeletal are your eyes actually. Dry eye is an issue that I have found because you are sitting there continuously throughout the day staring down the microscope without blinking, because when you are doing anything with concentration, your blink rate comes down from 15 to 20 to 2 or 3 times a minute. So that creates an issue for your eyes, and then you are in between, whenever you get little time, you take your mobile and you will be going through WhatsApp or maybe texting and all. And then once you come home, once again you are on your WhatsApp. You are in multiple me group or I group, I do not know, but which multiple groups are there. And then you sit late in the night. I sit and read in the night actually. And then I see a movie. So sleep at 12 o'clock, 1 o'clock. That means the entire day your eyes are exposed and are dry. So this is one thing you have to do exercise like what you tell your computer vision syndrome patients. Practice them also and take care of your back and neck too.